Mr. Speaker, last week, Secretary of Health and Human Services Kathleen Sebelius announced that despite her department's best efforts, what is known as the Class Act is not fiscally viable and will not be implemented. The Class Act would have created a long-term care insurance option for employees, but you know what? It had been called a Ponzi scheme of the first order. Not my words, not even my governor's words. Those are the words of Senator Kent Conrad, the Democratic chairman of the Senate Budget Committee. Mr. Speaker, this is just another example of bad policy that was caused by the rushed approach to create and pass the Patient Protection and Affordable Care Act. Instead of focusing on reducing the price of long-term care insurance, the Class Act would have cost the taxpayers more money for the creation of yet another federal program. Now, incredibly, the Class Act is being abandoned by the Department of Health and Human Services, but the President refuses to let it go. We'll have a hearing on this in my committee later this week on Energy and Commerce. But, Mr. Speaker, we can do better. Mr. Speaker, we must do better. We need to repeal this health care law, replace it with common sense, market-based solutions that enhance our medical system, put the patient at the center of care, and drive down the cost of health care. I yield back my